Good morning. I'm Kelly, and I'll be the presenter today for the neurological system of the older adult. We'll go ahead and get started with our first slide that has our learner objectives. The student will be able to identify 3 normal age-related changes to the nervous system of the older adult. The student will list the appropriate adaptability devices for senior adults with age-related changes. The student will rate the severity of the neurological status in the older adult, and the student will distinguish findings as to whether they are dementia or related to delirium in the older adult. The normal changes of aging in the older adult vary between different persons and our senior citizens. So lowered reflexes or sensations, memory loss, thermoregulatory issues, slowed thought processes, ability to perform tasks, vision changes and pain perception, vibration detection, the sense of taste and smell declines, slowed speech and hearing impairment. So in general, many of the senses of the older adult will just not be as acute and as keen as they were in the younger years. For example, you might see normal memory loss, such as a patient in the 70s or 80s who sometimes forgets where they place their keys or might have to search for a word they're looking for, would be a normal age-related finding. Long-term memory loss would be more associated with dementia, and short episodes of increased delirium would be more of an acute issue. So finding someone that has just general memory loss is a normal finding. Thermoregulatory issues, you'll oftentimes see older adults who feel cold in comparison to others in the room. Pain reception, so in the older adults, they may not interpret pain as readily. They also may not be able to voice their feelings of pain. So sometimes we have to look for other cues to know that they're in pain. Slowed speech and hearing impairment, all of the senses might decline slowly in the older adult. Common disease processes. One of the big ones for the neurological system is Alzheimer's disease. It's a form of dementia. It is not uncommon to see it in older adults. We have memory support units at hospitals, memory care. Dementia is unfortunately irreversible, but dementia can be shown a difference from delirium, with dementia being a slow, progressive onset, and delirium is usually an acute, sudden onset. And delirium can also be more severe, seen here. Furthermore, Parkinson's disease is a neuromuscular order, so the muscles are affected along with the neurological processes. Neuropathy, which is pain, nerve pain, a lot of adults suffer from this. The doctor might want to give them gabapentin or some other agents that help with that opioid pain relievers don't always work for. Stroke, the patient can have neurocognitive deficits after a stroke, especially in our older adults. It's something to watch for. Infectious processes, so if an elderly individual is acting untoward in any way, we might find that we want to test their urine for a urinary tract infection. Gait disorders, strength and muscle wasting. Although those are musculoskeletal types of diseases, the neurological process can have a big impact in those, as far as whether the patient's getting up daily, has motivation, and things of that nature. So the neurological and the muscular are intertwined. Let's next talk about further common disease processes. Head injury from fall, these can be major in adults, especially in those that are anticoagulated. Headache, spinal cord injury, incontinence, definitely something that affects older individuals. They may not have as good a control as their bowel and bladder. Seizures or pseudo-seizure activity, more common in older adults. Functional dependence, they may need help with their ADLs. Many of our older people are going to require assistance at the home or in the hospital setting. So if we notice a functional decline, that can be related to the neurological status as well. So the care and independence of older adults, we want to encourage them to remain as independent as possible for as long as possible. Promote independence in your elders. Don't help with every little thing. Allow them to try to do for themselves. Adaptive devices, hearing aids, glasses, the handheld reachers that help our older adults, screen readers, text-to-speech synthesizers. So there's a big improvement in informatics and technological advances that can help our older adults. iPhones, computer screens. Memory deficit adults may benefit from functional tasks and increased social skills. So making sure that We promote social skills and giving them task-oriented items to complete. And then physical therapy, kinesiotherapy, occupational therapy, and restorative therapy are all available in long-term care to help these adults. Okay. So other relevant aspects in our conclusion. Neurological disorders are a greater prevalence and early onset with people who are smokers, obese, and alcoholics. That's just another topic to keep in mind. Certain medicines or blood sugar issues can cause confusion in the older adults, so look for someone who has diabetes. The first thing you probably want to do is check their sugar before you might think it's delirium or dementia. Physical exercise is recommended. Crossword puzzles, reading, and engaging in social activities helps keep the mind sharp. Older adults can also face nutritional challenges, access to food because of cost and healthy food. A lot of our older adults are on a limited budget, so we know that malnutrition can exacerbate the neurological decline in adults. Questions. We have an 86-year-old patient who's in his IDT meeting with which of the following would demonstrate a typical finding of the older adult regarding the neurological process. The answer to this one is going to be A. The patient will know that their reaction time will slow. And the rationale for these questions can be found in your handouts. The next question. 74-year-old female that sometimes has to search for the word she's trying to use and misplaced her keys. But she knows she has an appointment she has to get to by 2:30, and she likes to leave a little early. The home health nurse is going to figure out that this kind of finding is a normal age-related change. This isn't sudden onset delirium. This isn't long-term dementia. The patient remembers her appointments, so that's how we analyze this. Final question. The nurse is performing a RENA test on a 93-year-old patient. The patient hears the tones for more than double the time when the tuning fork is by the ear as opposed to when it's placed on the mastoid bone. So, from your AMP1, you know that this is going to be cranial nerve 8. This is a normal finding. Document the results and continue the exam because we would expect air conduction to be double as much as bone conduction. Okay, and I have here your references for today that you can look at, as well as I want you to look at the associated PowerPoint and the handouts so that you'll understand the rationale of the questions. I want to conclude by bringing it all back in and saying that in the older adult we expect normal age-related changes such as loss of the sense of taste and hearing. All of these have an impact. So the loss of taste can affect malnutrition, loss of hearing can affect their ability to drive. So that's why we really want to promote independence in the older adult. Keep those neurological processes intact, allow them to maintain their independence as long as possible, and we want to be able to realize what are going to be normal age-related changes as opposed to looking at the dementia process or even the delirium process, which can often be associated with an acute illness of some other type. And at this point, I'll go ahead and conclude my lecture for today, and I want to thank everyone for attending.